Acid reflux is a condition which caused by the acid that is normally produced inside the stomach and to help digest the food is start moving in the reverse directions towards the food pipe or the gullet. The lining of the gullet are not designed to have an acid around them, and that's what tends to cause patients the symptoms that they feel related to this condition. Generally, acid reflux tends to be predisposed to by having a weak sphincter, which is the sphincter located at the lower end of the food pipe or the gullet. If that sphincter becomes defective and becomes weak as a result of an inherent weakness or perhaps a development of a condition called hiatus hernia, where part of the stomach move up towards the chest, that then causes the content of the stomach, including the acid and the food that we eat, to move up and down in the reverse direction and causing the patient the symptoms. Now, the symptoms typically are burning sensation felt behind the breastbone in the middle of the chest, starting lower down and tends to move up towards the back of the throat. And the patients, if they have a mild symptoms, they can have these symptoms once or twice a day and tends to be relieved by having a glass of water or some milky solutions, a glass of milk, or eating something, a small snack, or even having a chewing gum to help them produce a lot of saliva to swallow to neutralize the acid effect. The other symptoms in the most severe forms is actually the food that is meant to be staying in the stomach after we eat it can sometimes start to move in the reverse direction and move up towards the gullet, and can, in some severe conditions and some severe patients, can reaches to the back of the throat. And patients sometimes, if they lean forward or if they are lying in the sofa or in their bed, can have, after a meal, can have the food returning back into the back of their throat without much effort. And that is the severe form of the disease. Unfortunately, in some patients can have these symptoms at nighttime when they are asleep, in the middle of their sleep, and they can sometimes have the content of the stomach regurgitate back to the back of the throat and can, in some patients, make them wake up choking, coughing, trying to clear the airway as a result of a severe gastroesophageal acid reflux problem. The symptoms, if I answer this question perhaps in another way, the symptoms that it tends to be aggravated in some patients by eating alcoholic beverages or fizzy drinks, because they tend to increase the pressure inside the stomach. Any other food items that slows the emptying of the stomach, and that tends to be fatty and rich food, can aggravate the acid reflux condition overall. And we find there are personal variabilities between patients. Individual patients describes eating, for instance, onions, garlic, that tends to aggravate the symptoms, but that doesn't seem to be affecting every patient in the same way. The commonest over-the-counter medications are the antacids, and they are advertised widely and are available widely, given the fact that acid reflux problem is quite a common one. Usually they work as a neutralizing agent to the effect of the acid, and they make the fluid that goes back towards the gullet less acidic, and therefore causes less symptoms. These are how the antacids work. They are available either in tablets that you swallow, or a chewable tablets, or even in a solution. And the commonest one is the Gaviscon and the Gaviscon Plus solutions that is widely advertised on telly. The other over-the-counter medications are the proton pump inhibitors group, which is becoming recently, over the past few years, again over-the-counter without a prescription. They are known as omeprazole or lansoprazole. These are the Zol groups, and they work by reducing the amount of acid production. So they work on the cells within the lining of the stomach and make the cell produce less acid. And they help by having less acid produced and therefore less pain or less aggravation by the fact that the reflux is become less acidic. Those, we have to remember, all these medications tends to help by reducing the amount of acid or the concentration of the acid, but they don't stop the actual mechanical defect of the content of the stomach going in the reverse direction, which is the reflux itself. So the condition is quite common, and it is not uncommon for any individual to experience acid reflux once in a while. So infrequent symptoms that can be aggravated by eating certain food or indulge in eating rich food, that happens once in a while. It's quite normal, and people don't need to worry about this as long as it's not a persistent symptom. However, if the symptoms becomes frequent and becomes problematic despite using over-the-counter medication, then we would strongly recommend they seek medical advice. Now, initially, we tend to treat patients by giving them the strong medication for a short period of time, advise them on the lifestyle modification, dietary modification. If patient is overweight, we would recommend they lose weight. If they smoke, we recommend they stop smoking. If they drink excessive alcohol or fizzy drinks, we recommend that they manage that. Now, if symptoms persisted despite all these measures, then the next thing to do will be to examine the lining of the gullet and the stomach endoscopically using a camera that we pass through the throat to check the lining to confirm the diagnosis of acid reflux.